Good afternoon. This is Dr. Bobby Cawthron, lead veterinarian with Aspen Grove Veterinary Care, coming to you from Fort Collins, Colorado. And today we're going to talk about dental care specifically for cats. Cats, as I like to say, are not small dogs, and they are a unique species unto themselves, and they do have unique needs. We're going to first, of course, talk about the most important thing that we can do for our dental care for our cats, and that's home care. That's probably our most difficult thing to do as well for cats because they are just not amenable to a lot of handling when it comes to being inside their mouth. So this, of course, is prefaced by saying if you do attempt all these things to be very careful, and if you feel like you just can't do it safely, by all means, there's other alternatives that we'll talk about. But home care brushing is our most important thing we can do for all of our pets, and that does include cats. Getting in there and brushing their teeth on a very regular basis, and when I say regular, we're talking 3 times a week. It's important to do it often because plaque colonies, bacterial growth, will happen about every 24 hours. Even when you brush it off, it starts to reoccur very, very quickly. Now there are dental specific brushes and specific toothpaste that are important for cats. They of course do not tolerate things like fluoride very well, so you can't use human toothpaste. What's nice about our pet toothpaste for cats is they're usually flavored. So there's fish flavors and things like that that they're going to be a little bit more amenable to. And there are of course tricks to try to train them into doing this, slowly approaching the subject of brushing their teeth and getting them to a point where they're more comfortable with it. You'll also find that there are small headed toothbrushes that make it a little bit easier to be inside their mouth. And you can use those to help keep their dental health as good as possible. Now, if we also find that we just can't do that, and there's plenty of cats in the world that we can't, we of course try to find other alternatives. Now, cats are just not avid chewers like dogs, and so we don't have a lot of dental treats that help really well. There are some that are specific for cats, but they're usually small, they're little crunchies. They're not going to methodically chew on anything for a long period of time, but they probably provide some benefit. I then fall to a lot of these other products that are things that you put into their water or their food to help try to keep bacterial numbers down, keep the mouth a little bit healthier. There's some really nice powders that you can sprinkle onto the food that are pretty palatable that will also provide almost a pumice action to their chewing when they have it on their kibble, and it'll also provide beneficial bacteria as well as other things to manipulate the pH and try to keep that a little bit healthier. So there are things that you can do, and a lot of times when you're talking with your veterinarian on your annual visits, you can also discuss what we can do with your cat, see what they're amenable to, and come up with a plan of action for that. Now, number 2, of course, is professional care, and that's always going to be needed. As you probably know, if you brush your teeth every day, if you go to the extent of flossing 3 times a day, you still need to go see your dentist periodically and get a good scaling and evaluation done. We're going to recommend the same thing for your cat. What that does mean is going under anesthesia, which I know a lot of people are apprehensive about, but I hope that everybody will realize that the benefit of a good professional care periodically, even with an anesthetic procedure, really is a huge benefit, and the risk of anesthesia these days is extremely small. And so it's going to be an important part of an overall dental care. Professional care is going to include going under, looking at all the teeth, scaling, polishing, probing all the gum lines, x-raying their teeth, and making sure we're not having any disease of the teeth or the gums at that point. The last thing we wanted to talk about is the species-specific disorders that cats get, because they have some unique disorders that cats, and only cats, tend to get most of the time. The bigger ones that we tend to have with this is that cats can get a tooth disease that, honestly, it's been named several different things, but it's a reabsorptive issue. They actually start to reabsorb their enamel. The same cells that get turned on as a kitten to get rid of our baby teeth, to break down those roots and allow baby teeth to fall out, get turned back on as an adult. And we as veterinarians have no idea why this is happening, but it happens pretty often. And then it'll start attacking the tooth. It'll erode the enamel enough that it actually gets to be very sensitive. So you'll get cats in that are very sensitive with their teeth, and you can see literally a cavity-like lesion on their tooth and a lot of pain associated with that. And those guys, of course, need something done with it. Unfortunately, there's nothing you can do to stop the process from happening, slow it down, and keep it from progressing. The best that you can do is manage the problem that's currently in front of you, which unfortunately means we're usually having to remove those teeth. So that is something we're looking at every time we see a cat. We're doing an exam, we're looking for those kind of problems, and that's one that's really specific for cats. They also get a couple of other disorders. They get some chronic gum disease that becomes almost immune mediated, meaning the body kind of attacks its own gums, if you will, that needs special care as well. And so your cat is going to have certain things that you're just not going to find in other pets, especially dogs. That's something that we're going to be looking for, of course, but you can keep out signs for that. If you find that your cat is having difficulty eating, especially kibble, only really wants to eat canned food, seems uncomfortable when they're eating, if there's a really bad smell to the mouth, if you lift up a gum and you notice it's super red and ugly, it may indicate that you've got some significant disease going on in that mouth. If you have any concerns about that, the next best step, of course, is to go see your veterinarian, have a discussion about what we think might be going on and where you might want to go from there. For more information or details on this specific subject, please visit the blog on our website.